Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Cervicitis. The causes of cervicitis include chlamydia or gonorrhea. The most common site of cervicitis is endocervix. Other sites like urethra, Bartholin glands can also be involved in cervicitis. Actually, the squamous epithelium is resistant to chlamydia and gonorrhea. Most common symptom of cervicitis is presence of mucopurulent discharge. Now, because the squamous epithelium is resistant to chlamydia and gonorrhea, cervix ectocervicitis is not much common. Whereas, no, sorry, because the squamous epithelium is resistant to chlamydia and gonorrhea, vagina is lined by squamous epithelium. So, vaginitis with chlamydia and gonorrhea is not common, whereas cervix is lined by simple columnar epithelium. So endocervix is lined by simple columnar epithelium. So chlamydia infection or gonorrhea infection in endocervix is common. The most common symptom is mucopurulent discharge. Other symptoms like dysuria, postcoital bleeding, intermenstrual bleeding are also seen. On per speculum examination, discharge can be seen coming out from the os and it is friable. Cervix can also be seen. Treatment of choice for cervicitis. For chlamydia, we give doxycycline 100 milligrams BD for 7 days or azithromycin 1 gram is given orally. For gonorrhea, ceftriaxone 250 milligrams IM stat it is given along with azithromycin 1 gram is given orally. Cervicitis. The cause
Treatment for chlamydia, doxycycline is given 100 milligrams BD for 7 days or azithromycin is given 1 grams orally. For gonorrhea, we give ceftriaxone 250 milligrams intramuscularly start, whereas azithromycin is given 1 grams orally.
thank you and thank you for watching.